Hi, Dr. Chad Mcgee here again to talk with you today about colic in your horse. All colic means, and I hear a lot of people, anytime the word colic comes up, they get really upset and worried, and really all colic means is just any form of abdominal discomfort. So there can be a number of different reasons for them to be uncomfortable, from them having a little bit of gas to them having a strangulated piece of bowel that needs surgery in order for them to survive. Some of the things that you can see if your horse is colicking. Everybody has heard of the horse that you can't keep on its feet, and it's up and down and throwing itself on the ground and rolling and thrashing, just super uncomfortable. You can also get a lot less descript things in there, or a lot less specific things that are less dramatic and easier to miss in there that can also be manifestations of colic as well, from them flamining, where they extend their head and neck and pick their upper lip up, to they might just be turning from time to time and flank watching a little bit, turning and looking at their belly. They might be kicking at their belly, swishing their tail. They may posture like they're going to urinate and don't urinate, and really just kind of trying to position themselves so that they get their abdomen in a little bit more comfortable spot, or they're essentially trying to. You can have all of that, and then you can certainly have your horses that they just didn't clean up all of their supper that night. One of the things that I always want to know from my clients is the signalment. So what kind of horse it is, how old it is, and also if it's ever colic before. So that'll really give me a lot of information as far as whether or not that horse is going to need to be seen or not, and likely whether or not it'll respond to a dose of Banamine. But regardless, before I have my owners give a dose of Banamine, I want them to give me a buzz so that I'm on page with them and I can get some other information from them before the Banamine sets in. Some of those things that are really important that I want to know, one of them is heart rate. A lot of times that horse that has that strangulating lesion that's going to wind up needing surgery, that didn't finish his dinner, he's really not acting all that uncomfortable. He may be sitting on a heart rate of 80 plus. Which is a really big indicator that you've got an animal that's really painful and he's just doing a good job hiding that. A lot of times horses will look pretty dull and depressed if they've got a good fever going, and rightfully so. If you or I have a fever, you don't feel like doing a whole lot. But if you were to take aspirin, which is another non-steroidal anti-inflammatory drug just like Banamine, it's going to help to knock down the fever. So Banamine's going to hide that as well. So before going to giving these medications, it's always a good idea, give your veterinarian a buzz, and they can give you some advice. Even if you don't think you're quite ready to have the vet out there, they can certainly give you some really good advice on just how to go about managing these cases. Hopefully we answered some of your questions, and thanks again. Take care.